Chapter 12, Nervous System, Nervous Tissue, Part 4. All right, it turns out for a properly functioning neuron, you need a lot of different kinds of transmembrane proteins. These proteins are critical for the generation of the nerve impulse and the transmission of it along the axon. So first up is pumps. Pumps are transmembrane proteins that transport ions against the concentration gradient. And since it's going against the concentration gradient, it's going to require ATP. Two examples that are important in neurons include the sodium-potassium ion pump and the calcium ion pump found in plasma membranes. So sodium-potassium pump, here is the transmembrane protein. You add energy and it allows sodium ions to leave, 3 sodium ions leave the inside of the cell, go into the outside of the cell, and then it allows 2 potassium ions to go from outside the cell and move into the cell. 3 sodium out, 2 potassium in per ATP expended. Then we have channels. Channels are transmembrane proteins that are open and often always open. So leaky channels are always open. They allow materials of proper size or charge or whatever to move from high concentration to low concentration. So diffusion is continually occurring, and sometimes the diffusion can go the opposite direction. So that's what makes them leaky. Usually things are traveling in one direction, high to low, but sometimes things change in concentration gradients and a little bit of sodium can escape. There are sodium ion channels and potassium ion channels, and I found in the membranes of neurons, and that's part of the reason why we need these sodium potassium ion pumps, which is to maintain the concentration of distribution of sodium and potassium ions, counter all that leaking. Then you have the chemically gated channels. These channels, often known as ligand-gated channels, have a receptor that binds some chemical. For the nervous system, that chemical is the neurotransmitter. The neurotransmitter can bind to the chemically gated channel, opening it up, and then the proper ion will move from high concentration to low. So normally it's closed, neurotransmitter binds, now it's open. Now in this case, potassium ions can go from high concentration to low concentration. Also see chemically gated sodium ion channels, chemically gated chloride ion channels. There's a lot of those at synapses. Then you have voltage gated channels. Voltage gated channels will open when the charge, the voltage around that transmembrane protein changes and activates it. So here it is inactive and closed, nothing's happening. Change in charge causes the opening of the gate. So now, in this case, sodium ions are moving from high concentration to low concentration, flooding into the cell. So voltage-gated sodium ion channels, voltage-gated potassium channels, voltage-gated calcium ion channels all exist. All right, so with sodium ion channels, voltage-gated sodium ion channels, they actually have 3 states. The first state is resting state. When they are resting, they have the inactivation gate is open, but the activation gate is closed. So it's like they have 2 doors here. One of the doors is open, the other door is closed, so nothing can pass through the channel. Then they have the activation state, so that when that change of charge occurs, the activation gate opens. The inactivation gate is also open, so sodium ions can flow through the channel into the cell. And finally, after a little bit of time, the inactivation gate will close. And when that closes, that stops the movement of sodium ions into the cell. This is a short-term event, but it is very critical for the function of the voltage-gated sodium ion channels. And then eventually we'll get a redistribution of the ions via the sodium potassium ion pumps, and the activation gate will close and the inactivation gate will open. So resting state will be reestablished. All right, where are these various pumps and channels located? Well, the sodium leak channels and the potassium leak channels are all over the entire plasma membrane of the neuron, the entire thing. And the same for sodium potassium ion pumps. They are found all over the entire plasma membrane of the neuron. And the sodium potassium ion pumps, as we say, maintain the proper distribution of sodium and potassium, lots of sodium outside of the cell, lots of potassium inside of the cell. Then we have various channels and pumps located in certain areas. So in the receptive segments of the neuron, so cell body and dendrites, that are the receptive ends for synapses, we have the chemically gated channels. These are the channels that open when bound to a neurotransmitter. And they include sodium ion channels, which is the most common, as well as potassium ion channels and chloride ion channels. Probably some others too, but these are the ones we'll learn about. Then we have voltage-gated sodium-potassium ion channels in the axon hillock. And basically, these are going to operate, will be stimulated when the charge in the area of the axon hillock reaches threshold. The threshold is negative 55 millivolts. So the resting potential is negative 70 millivolts. If enough of these receptive segments open up their chemically gated channels, then that could cause a great enough change in charge to get to that negative 55 millivolts, causing the voltage-gated sodium-potassium ion channels to open. So the summation of changes in charge from the receptive areas are what cause threshold and the opening of voltage-gated ion channels in the axon hillock. Then we have the conductive segment, aka the bulk of the axon. Here we find lots of voltage-gated sodium and potassium ion channels. And they are what is generating the action potential and propagating it down the length of the axon. And they allow for a lot of depolarization. And then finally, we have the transmissive segment. The transmissive segment is the synaptic knobs that are helping to form the synapses. So the synaptic knobs of the presynaptic neurons. They possess voltage-gated calcium ion channels that, of course, open when the action potential reaches the synaptic knobs. And they also possess calcium ion pumps. So they're always pumping calcium ions out of the synaptic knobs so that there's a high concentration of calcium outside of the synaptic knob, a low concentration inside, so that the voltage-gated calcium ion channels are able to cause a flood of calcium ions into the synaptic knob, which then bind to the synaptic vesicles, leading to the release of neurotransmitters. Whew. So all of these various membrane proteins are very important for the function of the neuron. All right, we also have the distribution of substances inside and outside of the neuron, primarily ions. So inside of the cell, we have lots of negatively charged phosphate ions. So these, of course, are important because they come off of ATP when it releases energy to form ADP and phosphate ions, and then they get added back to the ADP to give us more ATP. So lots of that, negatively charged. We have lots of negatively charged proteins inside of the cell, and then we have high levels of potassium ions. And overall, this leads to a negative charge inside of the cell. Then in the outside, in the interstitial fluids surrounding the neurons, we have high levels of sodium ions, lots of sodium ions, very positive, and also high level of chlorine ions, at least compared to what's inside of the cell. But overall, there's a positive charge on the outside. And this distribution of these ions lead to an electrical gradient, where it's overall positive outside of the neuron, overall negative inside of the neuron. And when a neuron is at rest, this electrical gradient gives it what's called a resting membrane potential. So the net charge over the plasma membrane is negative 70 millivolts. So the resting potential in a neuron is negative 70 millivolts. And when this is altered, it can lead to the action potential. We also have a variety of chemical concentrations of gradients being generated. So lots of sodium and chlorine on the outside, lots of potassium ions inside. So these are chemical concentration gradients that also can affect the movement of the various ions. So in terms of electrical currents, here's some concepts that are important in terms of electrical current over neurons. You have voltage. Voltage is the amount of difference in electric charge. So resting membrane potential, -70 millivolts, is the voltage of the neurons at rest. Current is the movement of charged particles, in this case ions. Greater the movement, the more stuff moving across, the greater the current, which can then be used to generate work. Resistance is the opposition to the movement of charged particles. Primarily, this resistance comes from the plasma membrane, which doesn't allow charged particles to cross it, except for at channels and pumps. And so the opening and closing of channels can increase or decrease the resistance in any particular segment of plasma membrane. All right, resting membrane potential, as I mentioned before, is when the excitable cell is not excited yet. And it is a negative value. It is -70 millivolts in neurons. So what establishes the resting membrane potential? Well, a big role is that of potassium ions. So potassium ions are huge in determining the resting membrane potential. As we can see, there is an outward movement to move potassium ions from inside the cell to outside because of the steep concentration gradient. So it'll want to move from high concentration to low. However, there's also a movement pull to move potassium ions into the cell along the electrical gradient. So again, it's negative on the inside of the cell. Potassium ions are positive, so they'll want to move into the cell to the negative charge. These two forces are opposed to each other, but over time they will reach equilibrium so that the push in and the push out are equivalent. And this is what generates the resting membrane potential. Most of it, not all of it, but most of it, say -60 millivolts, I made that number up, is generated when we get equilibrium between the movement by concentration gradient versus electrical gradient. Sodium ions leak out through the leak channels. They go partially because of they leak in, sodium ions are leaking in, partly because of the concentration gradient, high to low, partly because of the electrical gradient. They want to go to the positive side. They want to go to the negative side. So electrical gradient pulls them in because it's negative inside. Concentration gradient pulls them in because there's less sodium ions inside the neuron. This has a slight effect on the resting membrane potential. Say makes it now -68 millivolts. Again, I made that number up. And then, of course, the sodium-potassium pumps are pumping sodium out, pumping potassium in. Its main job is to maintain the concentration gradients. Lots of sodium outside, lots of potassium inside. However, moving these ions will have a small amount of effect on the resting membrane potential to bring it up to finally to the -70 millivolts. The sodium-potassium ion pumps function is critically important. They use energy, ATP, and it turns out about 2/3 of the energy used by neurons is to power the sodium-potassium pumps. Pretty amazing. So it is the combination of the function of all of these transmembrane proteins that establish the resting membrane potential at -70 millivolts. Again, most of it is from the potassium ions passing through the leak channels. Some of it, small amount from the sodium ions moving through the leak channels, and a tiny bit from the sodium-potassium ion pump. And then, of course, we're going to stop this part of the lecture right here.